In this slide, we will talk about meeting the care needs of residents in a culturally diverse environment. Introduction. You may be thinking, why do I need to know about the different cultural backgrounds of residents? By becoming more aware and appreciative of the cultural differences among the residents, you will be better able to show respect for individual residents, provide assistance in ways that are culturally familiar to residents, and develop positive relationships with residents. Throughout our history, many people of many different backgrounds have come to live in the United States. Historically, a number of people have come from other parts of the world to make their home in the United States. There are people of different races. There are people practicing many different religions. Some speak a language other than English. Many have different beliefs, values, ways of communicating, and ways of thinking based on their cultural background. In order to provide the best quality care and give everyone the respect they deserve, it is important to understand how culture affects the way we live our life every day. What is culture? First, let's take a closer look at the meaning of culture. Culture is a set of values, beliefs, and behaviors. Culture is the truths that are accepted by the members of the group. Most cultural rules are not written down. We learn them from other members of the group. Culture is like the air that we breathe. It is something that we do not think about directly. We take it for granted. We also see some differences between cultures in terms of attitudes and behaviors related to caring for older adult members of families. In some Asian and Latino cultures, for example, when parents get older, they typically move in with one of their children, who are expected to take care of them. Such expectations are less common in the United States. If a resident of a personal care home is relatively new to this country, he or she may find relocation to the personal care home to be especially stressful because this is different living arrangement than that which older people in their homeland are accompanied. Culture is very important because we tend to interpret other people's behavior through our own culture. We expect others to think and act the way people in our culture think and act. We even interpret their behavior through our own expectations. When people from different culture act differently than people in our own culture, we may consider their behavior to be strange, inappropriate, or even wrong. The most important thing to remember is that differences in culture are not good or bad. Differences in culture are not right or wrong. They are just different ways of doing and thinking. Direct care staff person need to understand and be respectful of cultural differences. Now we will talk about some of the ways you can communicate with non-English speakers. The number of people in this country who speak a language other than English is growing. Communicating with people whose first language is not English can take special effort. The following guidelines can be helpful. Speak clearly and a little more slowly than you usually do. Sometimes we tend to speak quickly, especially in my case, I tend to speak quickly, but I'm trying my pace. Okay. For people who speak English well, the fast speed may not be a problem, but a slower pace will give non-English speaker more time to process your message. Do not shout. Raising your voice or shouting will not increase understanding. Speak in a normal tone of voice. Avoid slangs or jargons. Use the written word. Draw pictures or show with demonstrations. Pay attention to body language. Notice the facial expression or use the arm or gestures to the person with whom you are speaking. This may help you to determine if a person understands what you are saying. Take time to consider how your words might be understood by someone who is not completely familiar with your language.